My name's Miss Nandratarath Ganshanar, and I'm going to be talking today about aortic aneurysm. So I'm going to talk you through the causes, diagnosis, and treatments available for aortic aneurysm. So what is an aneurysm? Well, an aneurysm is an abnormal dilatation of a blood vessel. The normal human aorta is about 1.5 to 2 centimeters in diameter. And we define an aortic aneurysm as an aorta greater than 3 centimeters in diameter. Most aneurysms grow quite slowly at about 1 to 2 millimeters a year. But when an aorta enlarges to around larger than 5.5 centimeters, there's an increased risk of the aorta bursting or rupturing. And at that point, we would recommend repairing the aorta to prevent this bursting. What are the main types of aneurysm? Well, aneurysms can affect any blood vessel in the body, but they do most commonly affect the aorta. And 3 out of every 4 aortic aneurysms affects the aorta in the abdomen or below the kidney arteries. So an abdominal aortic aneurysm, or AAA, is common, particularly amongst men of greater than 65, where about 1.5% of this population will have an aortic aneurysm. Thoracic aneurysms, which affect the aorta in the chest, are less common, but of course equally dangerous if they burst. So what are the causes of aneurysms? Well, an aneurysm is caused by a weakening of the aortic wall, which then dilates. And the main risk factors include smoking, high blood pressure, and high cholesterol. These are, of course, modifiable risk factors, i.e., something that we can do something about to reduce the risk. There's also a smaller cohort of patients who have so-called familial aneurysms, and these are caused by genetic mutations that are passed down along the family line. And these include patients who have syndromes such as Marfan or Ehlers-Danlos. These patients tend to develop aneurysms at a younger age, so in their 40s or 50s. What symptoms do aortic aneurysms cause? Well, the problem here is that most aneurysms are asymptomatic. They don't cause any symptoms at all. And indeed, the first time that you may know that you have an abdominal aortic aneurysm is when it bursts or causes internal bleeding. For some people with very large aneurysms, they may feel the pulsation of the aorta when pressing the belly. And for some people, back pain can develop. If the aorta bursts, then the patient experiences sudden, severe abdominal and back pain and might even collapse. This is, of course, a medical emergency, and the patient or family must call 999 or seek urgent medical attention. How do I diagnose an aortic aneurysm? Well, I will perform a full physical examination in clinic, and if I feel a pulsating enlarged aorta, I'll arrange a duplex ultrasound scan for my patient to more closely investigate the size. Of course, a large number of aneurysms are picked up as incidental findings on CT scans. So what treatments are available? Well, as I've already said, for patients with aneurysms greater than 5.5 centimeters, I offer planned or elective repair. And this will be one of 2 modalities, either open surgery or endovascular surgery. The open surgical repair involves a cut in the belly, opening the aorta, and stitching in a tube graft to divert the blood away from the weakened aneurysm wall. The endovascular or keyhole surgery involves inserting a stent graft via catheter and opening the tube within the vessel, much like an umbrella opening in the vessel, again to divert the blood away from the aneurysm. The open surgical repair requires that the patient has reasonable heart and lung fitness to withstand a major surgical procedure. The endovascular repair requires that the aorta is of a reasonable size and shape for a stent graft. If you come to see me for your aortic aneurysm, I'll make sure that you get the right treatment for you to prevent aortic rupture and other complications.